Hello everyone, I am Dr. Komaldeep Kaur, working as Assistant Professor in the Department of Pulmonary Critical Care and Sleep Medicine at Government Medical College and Hospital, Chandigarh. So there are many recent advancements made not only in the diagnosis part but also in the treatment part. Advances in diagnostic tools like genotypic testing, for example CBNAT, that is cartridge based nucleic acid amplification test, and LPA, that is line probe assays. These tests are not only faster, they are very sensitive to the tune of up to 98%, and they tell you the diagnosis, and also along with that they also give information regarding the resistance to the first line drugs. Then we have TrueNAT. TrueNAT is a battery operated and chip based test. The machine is very easy to handle, and it helps in the diagnosis of TB in very remote, you can say, peripheral areas where these high-end equipments are not available. Then continuous research is also being done to improve the adherence of treatment by making patient-friendly regimens like injectable-free regimens, then shorter duration regimens. Then new drugs have also been incorporated into the DRTB regimens like bedaquiline and delaminate. Then BPAL regimen, that is bedaquiline, pretomanate and linezolid, a 3-drug regimen which is currently under operational research use. It has 3 drugs and 26 weeks is the duration, in contrast to 8 to 9 drugs and 18 months duration of the conventional DRTB regimen. Then screening and TPT. It has also been incorporated in the latest guidelines. TPT means tuberculosis preventive therapy, and the targeted population is the vulnerable, that is high risk population, which are at high risk of getting tuberculosis, and also the close contacts of the TB patient, recently diagnosed TB patient. Then extensive research is also being continued into the use of vaccines against tuberculosis. So TB is called by a bacteria called as Mycobacterium tuberculosis. So on the basis of drug sensitivity pattern, we call it as DSTB or DRTB, that is drug sensitive or drug resistant TB. If it is sensitive to the first line drugs, that is rifampicin, isoniazid, pyrazinamide and ethambutol, it is called as drug sensitive TB. But in case if it is resistant to any of these drugs, it is called as DRTB, that is drug resistant TB, and it will be called as monodrug resistance if resistance is found to against one drug, and it will be called as MDR-TB, that is multi-drug resistant TB, if the resistance is found against 2 important drugs, namely rifampicin and isoniazid. And then there is a term called as XDR-TB, that is extensive drug resistance TB. It is when you have resistance against these 2 first line drugs along with additional resistance against second line drugs, that is levofloxacin, bedaquiline or linezolid, or both. Delay in the diagnosis and treatment of tuberculosis, it has detrimental effects not only on the patient but also on the family members who are taking care of the patient or the close contacts of the patient. On the patient's part, the disease increases in severity and can lead to increased morbidity and mortality. Other thing, it can also lead to development of drug resistance. Second, on the part of the close contacts, it poses if we delay the diagnosis and treatment, it poses a great risk of transmission to the family members or the close contacts. So it is very important to diagnose the TB timely. So my message to TB patients would be to stay committed to the TB treatment. In case if you feel any adverse effects during your treatment course, you visit your treating doctor and discuss your symptoms with them, and don't stop your medication on your own at any point of time. One more very important thing: 2 to 3 months after the initiation of your treatment, you may become symptom free, but to become disease free, you have to complete your TB treatment course. Take care, you all. Thank you very much.